Do you suffer from PCOS? Then you need to know this. Polycystic ovary syndrome is a condition in which the ovaries produce an abnormal amount of androgens, which are the male sex hormones that are usually present in women in small amounts. So we need to get those androgens back to normal levels. PCOS symptoms include infertility, weight gain, trouble sleeping or sleep apnea, excess hair growth, feeling of anxiety and depression, headaches, irregular periods including spotting, pelvic pain, skin tags, darkening of the skin, acne, oily skin, dandruff, and hair loss. So what are the symptoms your doctor may look for? Multiple ovarian cysts, high levels of male hormones, specifically androgens, like we said, high levels of insulin or insulin resistance, and regarding cardiovascular problems, nope, we're gonna neglect that. Now, the standard PCOS treatments do not tend to be successful because they don't look at the underlying cause of PCOS, which is abnormal amounts of androgens. And what causes high androgens? High levels of insulin. And how does insulin cause PCOS? It does so through two different mechanisms. The first one involves a hormone from the pituitary known as luteinizing hormone. When insulin increases, there is a spike in luteinizing hormone, which comes from the pituitary down to the ovaries. Once this hormone connects with the ovaries, it triggers this cell known as thecal cell to increase androgen production. The next mechanism has to do with the liver. There is a buffering mechanism in your liver known as sex hormone binding globulin. This compound buffers androgen levels to keep them within normal levels. When your insulin is too high, this compound decreases, and thus you get less buffering, and you get more free testosterone, which is a type of androgen. So there you have it, the two different mechanisms on how insulin increases androgen production. And what causes high insulin? Foods like these: high carbohydrate foods and sugar. These would include pasta, biscuits, rice, white bread, cookies, pastries, dried fruit, which are all known as high glycemic foods. If we take a look at how each macronutrient affects insulin or blood sugar levels, we can see carbohydrates spike insulin the most, followed by protein and fat last. And this is especially true if those carbohydrates come from pure sugar or white bread, cookies, biscuits. So now you know, PCOS is caused by insulin because high insulin makes a lot of androgens. If we drop the androgens back to normal levels, you'll see your PCOS symptoms start to go away.